Fungal diseases of the skin, symptoms and prevention. Today, fungal skin diseases are an urgent problem for many people. The impetus for the development of mycosis can be not only walking barefoot in public places or poorly fitting shoes that provide the fungus with an optimal climatic environment, fever and sweating of the legs, but also a weakening of the immune system, as well as endocrine diseases of the pancreas, diabetes mellitus, or thyroid glands. Fungi are everywhere, in the air, in the soil, on the skin of every person. A healthy organism is in symbiosis with a fungus. But it is worth changing the conditions, and the fungus immediately violates the neutrality. The expert was asked about how to protect yourself from a fungal infection, what to do in case of infection, and how long to treat the consequences of mycosis. 1. Keratomycosis, diseases in which fungi parasitize in the superficial parts of the stratum corneum of the epidermis and do not cause acute manifestations of inflammation, and therefore rarely cause itching and discomfort. Often appear as a variety of spots on the skin of the back, chest, shoulders. The color of the affected area can be from soft pink to dark brown, while there may be slight peeling of the skin and intermittent itching. 2. Dermatomycosis, diseases in which parasitic fungi grow in the deeper layers of the skin and can affect hair and nails, Onychomycosis. This group of fungal lesions is characterized by high contagiousness. Rashes may be accompanied by allergy-like vesicles near the main lesion. Clinical signs: reddening of smooth skin, skin folds, color from pink to bright red. In places of inflammation, hair may fall out. Affected nails change shape, exfoliate, become yellow, brown, and an unpleasant odor may appear. 3. In separate groups, fungal diseases that cause malassezia and candida can be distinguished. These representatives can normally live on the skin and mucous membranes of a person, saprophytes. But under certain conditions, antibiotic therapy, reduced immunity, violation of hygienic care, can acquire pathogenic properties and cause diseases such as candidiasis, oral mucosa, genitals, rarely smooth skin, nails, sporadic dermatitis, folliculitis, reticular papillomatosis. Diseases can be accompanied by severe discomfort, itching, burning. Visual signs: skin and mucous membranes are red, irritated. Where is it most common to get a fungus and how is it transmitted? Unfortunately, everyone can become infected with a fungus, because we have a large number of social contacts. We are constantly surrounded by many people. Sick people carry a fungal infection, therefore, they are more likely to become infected when visiting a pool, saunas, water parks, baths, beauty salons, hairdressers, etc. The likelihood of getting sick increases in older people, with diabetes, diseases accompanied by impaired blood circulation in the extremities, which can lead to violations of the barrier properties of the skin. How to treat onychomycosis? Is it possible to fix the problem on my own or only under the supervision of a doctor? Diagnosis and treatment of onychomycosis should take place only under the supervision of a physician. At the same time, it is important to correctly diagnose, which the patient cannot do on his own due to the lack of knowledge and experience in this area, as well as the appropriate equipment. As for the treatment, it all depends on the location of the lesion, the depth of the lesion of the skin, the area. Treatment requires a systematic and clear implementation of appointments. Otherwise, a positive result will not be achieved, and the disease may become topical. In the treatment of onychomycosis, various dosage forms are used: creams, ointments, special kits, etc. A systematic approach includes the need to take antifungal tablets. At the consultation, the dermatologist must explain in detail and justify the principles of treatment and the importance of its correct implementation. How long does it take to cure a fungus? Depending on the location of the lesion, the area and depth of penetration of the fungal infection, treatment takes from several weeks, 21 days, to several months, 3 to 9 months. What can you recommend for the prevention of this disease? What are your top tips for your patients? My main advice is to live a full, happy life. And stick to these simple rules. Watch your personal hygiene. Use individual bath accessories. Do not try shoes on bare feet in stores, clothes, on the body without underwear. Have your own set of manicure and pedicure tools. If something is bothering you, seek help from a dermatologist.